Playtime at Surrey Square Primary School in one of the more deprived parts of London.
We see that our children and their families are facing lots of different issues, so living in cramped housing conditions, financial insecurity, immigration issues, domestic issues. So for our children, they're experiencing lots of different issues before they even step foot into the school gate.
Today, the Institute for Public Policy Research, the IPPR, has released the findings of its 3-year Commission on Health and Prosperity, with a call for the government to prioritise a new beginning on child health. But they're already tackling this here, working with the community. They've set up the Old Kent Road Family Zone. They have market days with free food, clothing and health sessions.
It's brought out everyone in the community, which it addresses isolation from COVID, it addresses financial insecurity, we address environmental issues such as recycling. We have a food shop that provides fresh veg and lots of canned and food from all over. And we are able to provide a space where they can come and have a cup of tea and sit and chat with their neighbours. And we've seen it does amazing things.
And they've also set up a youth club.
I usually play football with my friends. I go on the Bounty Castle and to be fair, I just have fun with my friends.
Good. And tell me about Marketplace.
Marketplace is really fun because you get to make new friends from different schools and secondary schools, and you also get free lunch there. So it's really fun, and you get to do different activities.
Today's report says overall the country needs new strategies to revitalise the economy, to move away from a sickness model, to get people back into work and to give them a healthy start. A theme indeed visited by the Lib Dem leader at party conference today.
If you help people to stay healthy for longer, not only will you dramatically improve people's lives, but you will actually save taxpayers money in the future and give the economy the boost it needs.
Last week we had Lord Darcy's report, this week we have this one. Both of them are saying we have to do something about the nation's health, starting with our children. But once again, the solutions come with a fairly hefty price tag.
Sure Start should be revived, it says, set up under the last Labour government to support families of children under 5 in England. It was cut under the Cameron government. But the Old Kent Road Family Zone is a version of this. Camille Phillips credits it with drawing her out of her isolation.
The first one I attended, they were asking about opinions of how they could, turn things around, how they could change maybe their setup or anything that we needed that they could provide. We wrote some things down and then we moved into a bigger space the month after they opened up the main school. And I was like, oh wow, this feels very permanent and it felt very nice. I wanted to volunteer. And yeah, started from volunteering and now, I'm actually working in the school and working for the community marketplace.
Today's report also calls for increased regulation and taxes on vapes, unhealthy foods and alcohol.
The easy choice is the unhealthy choice. And that will take a lot of people shifting, not a lot, but a certain amount. And then people have to get used to it. The libertarians who say you're taking away personal freedom, oh great, they haven't tried living with the ill health that all of this lifestyle gives. And they don't understand the evidence about how long it takes to change habits and behaviours.
The government response is largely to agree. You can't build a healthy economy, they said, without a healthy society. But they did not commit to any more funding.